Well, welcome to this edition of the Expert Series on NetStream Network. And I'm Joe Osamendi, your host. But that's not the most important thing. Most important thing is the guest we're going to have today. And also my co-host there in the studio, Mr. Roy Swift, who normally is from Washington, D.C., piping in, but he decided to walk up here because he needed some exercise this morning.
That's
so he
right.
came in. So Roy, welcome to the program.
I am so glad to be here in person for a change instead of on the screen. And I feel that this is such an important TV series with the experts that we're going to be talking to one today. Because certification is an area that does not get discussed enough with the general public to understand what's available and what the many opportunities are with obtaining a certification with some academic preparation and sometimes without academic preparations in this regard. And it's in line with our whole thinking that there should be multiple pathways for people for success in this regard. So I'm extremely excited to be here. We're going to talk about an area that certainly is growing, about surgical technologists assisting, surgical assisting personnel, with all these clinics and all sorts of health facilities cropping up, surgery being done everywhere. And so I'm very excited that we have Robin here today from the National Board of Surgical Technology and Surgical Assisting.
Well, welcome to the program, Robin.
Thank you.
You know, when we talked the other day, I think this is just such an important area that the public doesn't understand. So I'm really happy you're going to be talking about this, because when people go to an OR and all they see is the doctors and stuff, they don't understand there's people behind that set that are setting that room up for them. So that the tools are in the proper places, the room's set up the way it's supposed to be, so nothing can really go wrong. And that's the area of expertise that you're going to talk about today. Am I correct?
Absolutely, absolutely. I'm from the Board of Surgical Technology and Surgical Assisting, and we call it MB for short, because that's quite a mouthful to say. So we call ourselves MB, and we are the certifying organization. We have been offering certifications to surgical technologists for 55 years. So since 1970 was the first exam that was issued to ensure that these professionals who are in these operating rooms have some basic knowledge and skills to be able to assist the surgeons and assist with patient safety. So surgical technologists do a number of things. We have two certifications, one for surgical first assistants and one for surgical technologists. And these are the people who ensure that operating environment is sterile, that the right instrumentation is there, that the surgeon has all of the tools that they need to be able to do their services, and that the operating room is safe for the patient. So again, as you've indicated, sometimes people don't see the surgical assistant. There are typically always at least 7 or 8 people in an operating facility. But surgical assistants not only work in hospital systems, they also work in the surgery centers. They may work, actually, some practitioners do surgical procedures within their offices and dental offices and a whole bunch of other places where these professionals do work and provide their services. So, but there's always a surgical assistant in the team, and if there's any type of surgery being done. So this is a professional, again, most times people are out by the time they know that these folks are there, but they are extremely important in making sure that, but when that surgeon comes in that room, that everything is ready to go, and knowing that they're going to be safe and that environment is sterile.
You know, a lot of things that people don't even think about, you're going to talk about right now, is like when an operating room is set up. Maybe the doctor wants his tools in such, in a particular order, let's say, for instance, so the operation goes quickly. That's what your group does. If anything has to be done with that operating room to make sure that the surgeons in there are totally comfortable with the surroundings, that's what your group does. So without your group, basically, the surgery could not go as smoothly as it automatically does. And I think you're right. The public doesn't see this because it's set up before actually anything happens, and they're probably asleep, like you said, at the time. So I'm really glad we were able to point this out today, because that's something I think the public is going to be very happy to understand, that they're in better health because of people like yourself that are in your group. How long does it take to get a cert?
It typically takes anywhere from 15 months to 24 months because it's an AA degree. There are some certification programs that are still around, but they have evolved. All are transitioning now to an AA degree. So anywhere from 15 months to 24 months. We have 471 schools that we recognize that have accredited programs for people to attend. And these programs are throughout the United States of America. They are in not every jurisdiction, but at least 46 states have schools of some sort. It could be a community college. It could be offered through a university or a freestanding vocational program of some sort. So there are a variety of ways that people can enter the system. And not only that, we also certainly do recognize our military personnel. And there are programs that are for the Navy and the Army and for the Air Force, so that the professionals are able to work in the operating rooms of the VA, on the field, and in some of the clinics that are available for our veterans, and also for those who are in the field and who are deployed. And there's also opportunities so that when military personnel come out of the military, that they can be employed.
Yeah, and certainly the military sees the value, particularly in healthcare and particularly in this area, that people are certified. The thing about certifications is that it's measuring competencies. And one of the things that we hear at WorkCred in general is that other types of credentials say that the individual is coming with certain competencies, but they really don't have them. Certification is a much more assured process because it's very precise on how they validate competencies and how those competencies are measured in that regard. Rob, you might say something about your process that involves people with test and measurement background. And
Absolutely. And so we have exams for these two certifications that we offer. And again, we're examining their knowledge and their theoretical knowledge and their practical experience, because in their programs, they have to have practical experience. And so these tests are developed by people who work in the industry, by other surgical technologists and surgical first assistants. So these are the folks who set the standards. These are the folks who write the examination questions. And then we also work with examination professionals who ensure that the questions meet psychometric standards for the industry for exam programs. So this is not a small undertaking, and we really are measuring and the psychometric folks ensure that we're measuring what we say that we're going to measure, to be able to tell an employer, to be able to tell the surgeon that this person who is working with you in this operating room does have the requisite skills and knowledge to be able to assist you in this patient's safety. So it takes a long time to build an examination program. And we have many, many people who are involved in that process, and certainly people who are in the industry are in that process as well.
One of the things that I think is so impressive about your organization is the fact that you're in 471 schools. And this perfectly fits in with the community college format. And also with that all around the country, it gives people the opportunity to get into this program. Where a lot of places you wouldn't have it if you didn't have so many locations. So I think that's one of the strengths that you have.
Absolutely. And we want to make sure that people have the appropriate education that includes the clinical experience and the practical experience. We know that there are some fly-by-night programs that are out there that are really predatory for people who sometimes have a lot of money to be able to have training and build their skills to be able to be employed. So we want to let people know and recognize the difference in those types of programs. First of all, they don't get any recognition, and the employers are not going to accept them. So that's why it's unfortunate that people get lured into attending those types of programs that will be a dead end for them. So again, we want to make sure that people have the proper education, have access to the proper education, and that people recognize that they need to go to an accredited school, because all of the employers want the programs to be accredited. And also, even with our military, if people haven't gone to their accredited program, or when they are looking to bring civilians into their teams, they want people to have the certifications as well.
Yeah, that's so important in healthcare. And something that Robin mentioned that people kind of slide over is that when she talked about practitioners from the industry, they are the ones that predominate in help writing the content of the questions and the exam. And one of the issues, and she also talked about defensible, and we're talking about legal defensibility, that if you are ever challenged in court, the certification body the first question that the judge will say, does this exam really reflect actual practice is what's going on? So when you have practitioners developing the exam who actually do it on a daily basis, that's a pretty easy defense in a courtroom to be able to talk about.
And also, one of the things we do before we even get to those folks who are writing the questions for these exams is we do what's called a job analysis, where we actually survey folks who are working in the industry, and we ask them, what is it you do every day? How important is it that you do this, and what skills are necessary and what knowledge is necessary for you to be able to do this? And from there, that's how we develop the blueprint of what's important for them to know. What areas do we need to test people in? And then we have people to write those questions so that we can test their knowledge and abilities in those areas.
Robin, is there any apprenticeships that are available throughout the program?
There may be some apprenticeships, but our certification doesn't recognize the apprenticeships at this time.
Okay.
And again, as Roy has talked about, there are certifications and licensure structures that do have a variety of pathways. And I didn't say, but I have been in my role for a whopping, actually today is my 101st day
Okay.
at the NB.
Congratulations.
And, thank you. And so one of the things that I'd like for us to have a conversation about is the availability of pathways. We certainly absolutely recognize and want to emphasize the educational piece, because that's important, again, in those clinicals and the practical experience. But we also do know that there are some people out there who do have experience, and they have other healthcare backgrounds and other healthcare degrees that may be able to be recognized by us. So we absolutely want to have a conversation about how we can get more people into the workforce. And because, we know that in healthcare, in a number of areas, there are shortages, and absolutely in this area too, because surgeons do need to have surgical assistants. Surgeons do depend on them in many organizations, especially physicians who do surgery in their offices and those who use the surgery centers, they do select their own teams, and they want to have a competent surgical technologist around them, and they select certain people because of their certifications and their work with them.
It's so important, as Robin is looking for the future of different pathways. It would be helpful if higher education would move to competency-based education, because then they can compare competency to competency. Right now, transcripts are a description of a general course with a letter grade that often does not mean much, and that's difficult to equate when they're trying to look at how to bring more people in and give the opportunity. And we're going to see that in this environment where people may have to change jobs 4 or 5 times during their career. Right, Robin?
Yes, absolutely, absolutely. And so, and I think that there are things in the works to be able to have that connection that you're talking about. But traditionally, the structure hasn't been that way. And so there is lots of opportunity, and the work environments are changing, and what employers are looking for is changing. But also, again, one way that they can assure that people have the basic knowledge and skills is to recognize certifications. And those certifications that have been around a while, like ours, over 55 years, and our certifications are recognized by NCCA as well. So that means that we have met some standards in the area for certification programs as well.
Robin, we're going to have to take a quick break, pay a couple bills, but we're going to come right back and talk to you, so don't go anywhere.
Okay.
We'll be right back.
Okay, thank you.
I love that we both got an awesome network and save money doing it.
I know, $25. I love that it's guaranteed for 3 years.
Hey, we're sitting on a sign here.
Switch and get Welcome Unlimited for $25 a line, guaranteed for 3 years. Verizon.
Well, welcome back to The Experts. I'm Joe Osamendi, along with my cohort here, Roy Swift, and we're talking to Robin Jenkins about surgical technologies and surgical assistance, which are very important in the operating rooms that people don't know that too much about. So, how would you like to take and differentiate between the assistants and the technicians for us?
So with surgical technologists, these are the people, again, who are basically, they are responsible for making sure that that surgical environment is sterile, and that they manage the instruments that are in the room and the room overall, and make sure that that environment maintains its sterileness throughout whatever procedures are going on. The surgical first assistance is kind of it's a next level, it's a higher level. And there are some people who have both certifications. So with the surgical first assistance, their scope is expanded more. So not only are they ensuring the room is sterile, but they are also selecting equipment because they know this is going to be a knee surgery, or this is going to be a liposuction, or this is going to be a shoulder or hip replacement or something. So they're selecting the right instruments. They also are able to hold incisions open. They're able to close incisions from the surgeon, and they are able to control bleeding and some of the other things that are a little more invasive, I guess you would say. And so they do assist the surgeon much more in not just the environment as what's done with the surgical technologist. So again, that scope is expanded a little bit more, and also it depends. Some hospital systems may have other duties that may be allowed as well. And surgical technologists, again, are because the surgical technology certifications are portable. So if they're recognized by many employers. So if you want to move from one jurisdiction to another, or one hospital to another, it's not a difficulty, or you won't have to reapply to be able to work in another jurisdiction.
The surgical assisting, are they mainly in hospital ORs, or are they expanding into surgical clinics too? Or maybe they're needed more there, I don't know.
Both professionals are in all of the facilities. Again, they are in hospitals, they are in surgery centers, they are in practitioner offices, and in dental offices as well. So wherever there's some surgery that's being done, that's where you'll find either of these professionals, and sometimes you might find both of them. But we do have a number of certificates. We have close to 87,000 certificates, and we have a number that have both of these certifications. That allows them a lot of more flexibility, that allows them a lot more options for employment opportunities as well.
There must be, I see a very big opportunity here for some of our viewers that are looking to change their direction of their life and everything. And I think one of the reasons is you see more of these surgical clinics coming up, rather, as not going to hospitals. So I would think that the opportunities of either being an assistant or a technologist are just really great at this point.
Oh, absolutely. And the Bureau of Labor Statistics sees that there will be a 7 to 10% increase in the need for the number of these professionals by 2030. And so this is an opportunity of growth. This is a profession where people will be able to obtain employment. Again, if they have the right certifications that go along with the education. So and salaries, again, salaries depend on the jurisdiction that you are in. So of course, if you're in Los Angeles or Washington, D.C., Chicago, those salaries will be higher. But I would say that the average salary of a starter in this area is typically about $50,000. And of course, you have surgical assistants and technologists who make a lot more than that. And then you have folks who are in the academics as well, the educators who instruct here.
Sure.
So we can't forget those folks as well. And those salary ranges vary as well. But this is a profession where you are able to purchase a car, where you are able to own a home, because it is a decent salary.
One of the things that we love about this program, Roy and I doing it, is it gives people such an opportunity to see what things are out there that nobody knew about before. And that's where we open people's eyes, because, this, like you said, the opportunity you offer within this economic environment, the ability of people to get jobs where they want to go, the ability to be fluid if they want to go to different locations because their certificates will go with them. Those are just invaluable to the person that wants to get a career started, or people who want to change careers.
Absolutely. And we do have, there are surgical technologists who are, I guess, travelers. So,
Sure.
they work for agencies and they travel from city to city, and they work in hospital settings or surgery centers where surgeons need them. And there are surgical technologists who may work in more than one center, or they work with more than one physician. But again, physicians sometimes do have surgical technologists that they do want to work with and they do call on when they are doing certain procedures. Absolutely.
You know, being a certification, certainly it's time limited, and there is something called recertification or maintenance of certification. Can you talk a little bit about the recertification of a surgical technologist?
Absolutely.
Or
So our certifications have 2-year cycles. So every 2 years you have to renew. And in order to renew, we want to make sure that you are continuing your professional development, that you're staying up to date with what's new in the industry, and that you're staying up to date with what's required for you to do your job, and again, to protect the safety of your patients. So they are required to have 30 hours and 38 hours for their certifications. And sometimes we have people who re-examine for us to be assured of their continued professional development and being up to date in the industry. Not too many people want to take a test again, but we have had people who re-examine. But the continuing professional development is so important, and sometimes that's offered at the job sites, particularly if it's a big hospital system. And sometimes, of course, people go to their professional conferences and things like that. Yeah.
You know, you mentioned about the locums too, because I'm familiar with that, with people that nurse anesthetists and people like that are in demand, and technologists and assistants. They can always go at these places. You're exactly right. They can work all around the country wherever they want to, and they're in demand too. These people are really in demand. So this is this is really good.
Yeah, because I mean, all healthcare professions, are experiencing shortages. Absolutely, for sure. And this is an area where we definitely need more surgical assistants, because the world of surgeries have just exploded, and we're seeing quite an increase in the number of surgical procedures that are being done in a variety of settings. 15, 20 years ago, you didn't hear anything about these surgery centers and things like that. They're everywhere now. And so many different things can be done in a surgery center that used to, folks used to have to go to a hospital setting to do. People can have, again, things like dental surgery. And even with this dental surgery, there are surgical technologists who are in the room.
I'm just so impressed with this interview with you, because it assures people of so much more health safety reasons that they never think about. These are behind the scenes things that make things like with a surgery clinic or a surgery center. The point is that sterilization and stuff is just absolutely important when you're going to these places, and you have to have people that are competent that can do these things. And I think this interview today is really going to assure the public, and our viewers are going to see, that they should be very understanding and helpful, that the places like you have that actually train these people and certify these people are invaluable to their health and safety.
And very achievable credential,
Right.
An AA degree, which gets you a good salary and a wage. You don't necessarily have to have the bachelor's
Right.
degree to have a good job.
Right.
And I think that's an important message to our
Absolutely.
audience today too, is that things like surgical assisting and surgical technologists are very respectable, admirable, and good paying jobs that can be achieved within the 18 to 20, well now 24 months period.
Yeah, 15 to 24 months. And also we cannot forget about our military brothers and sisters who,
Right.
when they leave the military, that they have an option to be able to, or that they have a a skill and a certification that will get them employed right away when they leave the military. Again, my father was a veteran. He was in the military. He was in the Army for 21 years. My son was in the Navy for 6.5 years, and I'm always conflicted with the Army-Navy game. So, but absolutely. So we want to make sure that our veterans have opportunities as well. But definitely, this is an area that's a good profession for a young person, coming out of high school, that again, easily attainable, 15 months to 24 months. But again, I want to advise folks to be aware of these fly-by-night programs that may be out there that are just are predatory. So you want to make sure that you're enrolled in a program where you are able to seek the credentials that employers are looking for, because employers want to ensure, and they have requirements for employees in the hospitals as well, that they have demonstrated certain knowledge. And so you want to be able to you want to be able to bring that certification and not have misused your funds that people work so hard for.
Joe, it's really the public, one of the best ways of knowing whether something is legitimate or not is if it has third-party review and accreditation, and which their programs do, and that's not always the case. So there may be some good programs that aren't accredited, but the first step is find the ones that are, and then evaluate against certain criteria and standards for those that are not. Because of the 8,000 that we think are in this country, there's the good, the bad, and the ugly. And we want them to always choose the good.
There you go.
Absolutely, absolutely. And as I said, we have the National Commission for Certifying Agencies, NCCA. We have that designation, again, that ensures that we're meeting the gold standards for how we operate our examination programs. And, that's a seal of excellence for us as well. Again, we've been in this industry for 55 years, exclusively offering certification just for surgical technologists and surgical first assistants. And so, there may be folks that do other professions, but we exclusively work with these professionals. And we are a non-for-profit as well. So, be careful. There are some for-profit. I won't say that for-profit is bad, but there are some for-profit companies out there, and as I said, institutions, and there are other certification organizations out there. But make sure that you research those as well, and use Roy's group to make sure that you're being able to evaluate the certifications that you may be seeking out there.
Robin Jenkins, thank you so much for joining us today. You've been a wealth of information, and I think that every one of my viewers is going to come back with a better understanding of how safe a hospital can be, or a clinical center, or anything like that, because of your organization. And I thank you again. And please just tell my viewers how they can reach you and who should call you.
Thank you. And I really appreciate the opportunity to come today to talk about this profession. And again, we are the National Board of Surgical Technology and Surgical Assisting. And our website is www.nbstsa.org. And I'm Robin Jenkins. You'll find me on our website, and willing and able to talk to you at any time. Thank you for inviting me, and I'll come back anytime and talk to you.
You're more than welcome, Robin. And thank you, everybody, for watching this expert series today. And we will see you next time.